Well, May, believe it or not, is just around the corner, and it's also National Stroke Month. To recognize the symptoms of a stroke by thinking of the phrase, be fast. That's what we want to teach you guys. The local team of professionals at Synapse Human Performance Center is focused on providing the community with the most state-of-the-art technology and therapies associated with stroke and recovery. Dr. Leonard Wright is part of the Synapse team and joins us to share more. Good morning, doctor. Thank you so much for joining us.
Yeah, good morning.
You know, just before we came on for this segment, we were talking about the importance of people being empowered with this information. So I want to say thank you for coming on for this segment for that.
Yeah, no problem. We're happy to share as much as we can. It's important for people to know what to look for whenever we talk about stroke symptoms, and then also that there's options available like what we have here.
All right, Dr. Wright, let's get right to it. Well, we often hear about strokes and likely know someone who has suffered from a stroke. Can you explain what a stroke actually is?
Yeah, absolutely. So a stroke occurs whenever blood vessels rupture in the brain and blood supply to part of the brain is interrupted. This affects the vital tissues that the brain has, and they don't get enough oxygen and nutrients. A stroke is a specific type of vascular trauma requiring rehabilitation and various therapies. The risk of suffering a stroke, though, increases with age, but strokes can occur at any time.
Yeah, we were talking about when my aunt suffered a stroke in her early 30s. So we were talking about the importance of knowing the symptoms so people can be empowered. What are the symptoms? And also, how can I recognize it as a bystander if I witness somebody else?
Yeah, it's super important, right? Time is of the essence with this type of thing. So some of the symptoms that we want to look for are muscle weakness, instability with walking, balance issues, dizziness, difficulty with speech, numbness, tremors, vision deficits, bowel movement disorders, cognitive deficits. You mentioned Be Fast. That's a great acronym to keep in mind. We're talking about balance issues there. We're talking about eye or vision trouble in one or both eyes, facial droopiness, the arm weakness, and slurred speech. And then if you have any one of those, it's important to call 911 immediately because time is important.
Really important information. We also want to give our viewers hope. So how can people recover after having a stroke? Because that is a scary word to hear.
Yeah, absolutely. Individualized care like what we provide here offers patients a good outcome for patient success. We work one-on-one with patients using all-encompassing rehabilitation strategies to test balance and eye coordination, hand-eye coordination, that is. Most critical aspect of this, though, is the rehabilitation has to be focused, it has to be direct and repetitive, right? Training, practice, and helps drive this rewiring of the brain. We're talking about neuroplasticity, which teaches us new ways and means to make up for any remaining disabilities or deficits.
Okay, so, you know, we're talking about this a little bit, but can you go into more detail on some of the specific therapies that are offered at Synapse for people who have suffered a stroke?
Yeah, so really it's going to depend on the severity of the stroke, where the stroke occurred at, but some important ones to keep in mind that we offer here are some advanced technologies and equipment that offer physical recovery options to help someone rehabilitate. Things like mirror therapy, interactive metronome, and endless rope are some things that we use constantly here at the center.
You know, one last question for me. We were talking about hope. What's your final message to somebody that's maybe suffered a stroke or that knows somebody that does about the idea that there are things that they can do and there is help available?
Yeah, and that's super important to know that they're not alone. Some patients regain normal body function within days, right? But some, it takes a long time and it becomes a healing journey. No matter how long it takes, it's a process, and rehabilitation can reverse brain damage. But it can help if a stroke survivor knows that there's options out there. At Synapse, we aim to offer customizable solutions that aid the patient in the best recovery process possible.
Dr. Wright, thank you so much for joining us this morning, and thank you for this very important information for our audience.
Yeah, no, thanks for having me.
All right, we'll see you soon. You can get additional information on all of the life-changing services Synapse Human Performance Centers offers. Go to synapsehpc.com or call 214-902-3400 for more information.